Consumers can improve the way that they partner with healthcare providers and services by believing in their own voice. Also by not getting intimidated by the acronyms and the confusing language and the clinical part of healthcare. We're never there as consumer representatives to understand the clinical information to the full extent. We're there because of our experience and our journey through as consumers through the healthcare service. And that's the expert advice that we bring to the table. So remember that our voice is just as important as the clinical perspective, because at the end of the day, it'll improve health outcomes for us as patients in the future.
I think we need to acknowledge very clearly that nobody in the service, in the health services, goes into that job in order to either do the wrong thing or to not do it as well as they possibly can. It's so easy for us to think everything about the service is wrong, but we, I think, need to step back from that to say some things are very wrong, but there were other things that are very right. And once we can find a point of agreement, it's a whole lot easier to work together. I think that consumers can really add value to services. We need, first of all, to be very mindful of our rights and responsibilities, because, you know, we're all there to actually achieve a positive outcome. And if we are not prepared, if we don't do our homework, if we aren't listening to what's going on, if we're not prepared to learn, we will not add the value that we could add.
The tips that I would have for consumers to make partnering with health services easier would be certainly, number one, be patient. Don't go into your first meeting with a health service expecting to change the world on the first day. It's not going to happen. But be patient and be confident in what you're asking. Don't be afraid to be pushy, I guess, but still staying within the bounds of working with the system, not against it.
Sometimes being involved in consumer engagement can be frustrating. It's sometimes slow work. And I would say to consumers, remember that this is a marathon, not a sprint. It's about developing relationships, building your knowledge of the health system, developing your networks with consumers and current health service users beyond just your own experience. And it's also remaining up to date with what's going on in other health services. So great models of care that you might want to see happening in your local area.